hear a lot of people are newly diagnosed, and especially in the United States, by GPs, OBGYNs, ENTs. And then there's a real sort of gap in time between when they find out that they're HIV positive and start to seek treatment. Are you seeing that, around the world? Is that a very unique thing to the United States?
We have seen that around the world, and it was demonstrated in the AIDS Treatment for Life International Survey, which we presented here in Vienna, that a large number of patients had been diagnosed, and it took a year to 2 years before they were placed on therapy. And I think what it points to is a real need to educate GPs on prescription of first-line therapy, and when in fact it is clinically beneficial for patients to be placed on antiretroviral therapy. And also to dispel any notions that perhaps someone is disqualified, for example, from being placed on ART because of substance abuse issues.
Right. Is that something that's a big hurdle for physicians? Are they unwilling to prescribe medication to patients that they think will not adhere?
I think that it is a hurdle that we need to overcome.
Right.
We noted that in some of the survey data, and we know that from anecdotal reports from a variety of countries.
Right. What was the most surprising thing to you in the Atlas data?
The most surprising thing about the Atlas data was that we found incredible gaps in not the quantity of conversations that are being had between healthcare providers and patients, but in the quality of it and the breadth of what is covered. For example, we noted that there was significant cardiovascular risk among those respondents to the survey, including in North America, but a failure to communicate about, for example, the risks of smoking that are even greater among people who are living with HIV/AIDS, the increased risk of developing lung cancer, the increased risk of heart attack and stroke. Smoking affects people living with HIV/AIDS in a much harder way than it does the general population. Yet, healthcare providers are not having conversations about smoking and its effects on general health. They're not asking questions about family history of cardiovascular disease. And so those are issues that need to be addressed in a meaningful way.
And are these cardiovascular risks that pre-existed in people living with HIV or are related to medication?
Some are related to medication. The others are related to a family history of cardiovascular disease.
Right. And what should patients know about visiting their doctors, about the importance of telling them everything?
I think people living with HIV/AIDS need to be empowered to be able to have meaningful conversations with their healthcare provider. And I think most healthcare providers are more than willing to have those conversations, even given the time constraints under which they're laboring. But we have a situation where many patients are not asking the questions or sharing critical, very vital information with their healthcare providers, and providers aren't asking the questions. And so you're right, in this era in which HIV disease management is extremely complex, and where healthcare providers are required to wear many different specialty hats, including now geriatrics, I think we have incredible challenges to overcome, all of which can, in some way or another, be dealt with more information, more tools to strengthen that dialogue between healthcare provider and patient around any number of issues, including adherence. For example, in the Atlas data, we found that a significant number of people living with HIV/AIDS in the survey were missing doses of their medication. They had been counseled by their healthcare provider, in most of them, on the importance of adherence, yet they were not provided tools with which to enhance their adherence to therapy. And so there is a very significant gap that needs to be filled. Not to mention, a sizable number of respondents thought that HIV drug resistance was a good thing. 38% in the United States. It was the highest of any of the other regions of the world. So we have challenges to get these messages out there, and just because we've said it once or twice does not mean that we've communicated effectively. We need to drill it in as much as we can, because we've asked patients to make a lifetime commitment to therapy. We therefore have to make a lifetime commitment to ensuring we achieve treatment success. We had other data in the survey indicating that people living with HIV/AIDS did trust their healthcare provider,
right,
as far as having their needs in mind and being willing to engage with them as an equal partner in treatment. But on Thursday we'll be at a late breaker abstract session presenting data on stigma and discrimination. and it includes among healthcare providers, and it does still exist and needs to be addressed. I can't go into it because it's embargoed until Thursday,
we'll
but
come back to you on Thursday.
It's a significant issue, and 30 years of the epidemic, we have issues related to disclosure, not just to immediate family members, but to friends, colleagues. So that data will be released Thursday, and I think it will be a real call to action, I hope, for us to be able to address these issues.
What do you think we need to do to help patients today who are very diverse and have different needs?
Well, I think you're right. The epidemic is a very different epidemic now than it was back in the 80s in the U.S. and abroad. And there are any number of challenges that we face. I think ultimately the only way for an individual to feel a sense of community is to feel safe enough to come out and live his or her life out loud and share their experiences. The reality is that we have hope as a result of HIV treatment, and that if we can get more people diagnosed into treatment, that we've seen expanded lifespans, enhanced lives of people becoming, yet again, very productive and active members of society. We need to continue to promote that fact, and there'll be data on Thursday on the issue of perceptions that lead to stigma and discrimination against people living with HIV/AIDS. They exist still. The most powerful weapon against that are people who come out like you and share with the world what it is to live with HIV, the struggles, the challenges, the rewards sometimes, because the reality is many people are living wonderful lives they would not have otherwise had it not been for the revolution in treatment that we've experienced. And that revolution came as a result of a tremendous amount of advocacy from within the very community that's been most affected by the epidemic. We need to promote testing as a human rights issue. People are entitled to know their HIV status, and obviously we then have a responsibility, a moral responsibility, to ensure access to treatment. We can't just test and not treat people. And so as part of our educational activities, we have been going out and training emergency room doctors and nurses, family practitioners, so that they can be the front line in diagnosing within their communities people who are living with HIV/AIDS. But it's important training them on first-line antiretroviral therapy so that they can become prescribers, because we don't have enough HIV prescribers in the United States or anywhere to really make a significant dent in the number of people who are clinically eligible for treatment. And so training them on first-line therapy, they can refer for second-line or for any complications, but training them to deliver that care so we don't lose people to follow-up as a result of an HIV-positive diagnosis. There's a lot of work to be done there.
Right. So last question, if you were going to give one piece of advice to a person living with HIV who maybe hadn't had the best experiences in the past with their doctors, what would you advise a person to do on their next doctor's visit to make it better for them and better for their long-term health?
I would advise having a conversation, an honest conversation with the healthcare provider, reassuring the provider that keeping as informed as possible about treatment and treatment options, sharing as much information as possible, and then asking the healthcare provider directly, are you willing for me to be an equal player in this healthcare team? If the answer is yes, an unwavering yes, you've got a good partner, and he or she may just need assistance from you in learning how best to communicate. If the answer is equivocal in any way, find another doctor. There are many out there who know how to engage with patients and make that treatment experience a success.